we need to all get on a welcome to the COVID 313 Coalition for Families and Students Town Hall. I'm Christine Bell, Executive Director of UNI, proud member of this coalition, and grateful to be here with you all today. So before we get started, like always, we want to make sure that we're able to get people on the right line and in the right place so that they can get the translation services, interpretation services that they need. So we're translating the town hall to Spanish and ASL. So Ophelia, will you please give the details on how to listen to Spanish interpretation?
Yes, thank you. Buenas tardes. Si gustan ver este video en español, por favor busca a Detroit Hispanic Development Corporation en su Facebook. Estamos en vivo transmitiendo este video al español y también lo vamos a poner en los comentarios el enlace para el video. Hoy la señora Cristina Ruiz Manzón y la señora Gloria Rosas serán su traducción. Gracias.
Thank you so much, Ophelia, and thank you, Christina and Gloria, for translating for us each and every week. We are so appreciative. And Julie, it's so good to see you. Could you please share the instructions for ASL interpretation? Thank you so much, Julie. So we also have chat moderators because, like always, we want to hear from you. So you can use the chat in your on Facebook, or you can text us your questions. And just to make sure that Brooke and Amy, let me make sure, yeah, we've got Brooke today, Lindsay, and Amy that are moderating the chat. So just to test whether they're listening or not and awake, can you please let us know where you're joining us from and what you're most excited to hear about today during our town hall? So stay with us for the next, I think we got 58 minutes so that you can stay informed and empowered. We have a collection of experts to share their expertise in a variety of areas and answer some common questions and the questions that you ask that you put into our chat or text us. The text number is 313-288-2082. Again, that text number is 313-288-2082. We'll have question and answer after most of the segments. If we can't answer a question today, we're committed to getting you the answers by early next week. And all questions asked today will be posted with their answers on onedetroitpbs.org. For our experts, please remember to speak slowly for our translators. They want to make sure that they're translating the important information that you're sharing correctly. Please turn off your cameras when you're not speaking to ensure that our ASL interpreter can be seen. And remember to mute yourself when you're not speaking. Terry Whitfield, the best timekeeper around, is with us again today. So keep your eye on the chat. He'll chat you your remaining time. He also will chat you if you need to slow down. So please make sure you're just keeping one eye on that chat. And if you go over your time, myself, Jametta, or Rajeshri, all of the monitors, one of us will come onto the screen and gently remind you to wrap up. We are so excited for today's town hall and all the great information. But to get us started today, for the last couple of weeks, we've been honoring teachers, and this week is not an exception. So I want to welcome Brooke on so that she can do our teacher appreciation segment. And look at that fabulous paint. Brooke is in our office right now, and I love our conference room paint. It's one of my favorite things from the pandemic. with painting our conference room. So Brooke, take it away for teacher appreciation.
So yes, thank you, Christine. As you guys heard, my name is Brooke and I am part of UNI. And as Christine mentioned, we have been honoring our teachers throughout the last couple of weeks. Nominations have been closed, but we are honoring teachers, and those who have been nominated will receive or have received a small token of our gratitude. So for this week, for teacher appreciation, we have, so our first up, we have, sorry if I butcher your name, Limari Rodriguez from Academy de las Americas. She was nominated by Judith Garcia. Judy's reasoning for nominating Ms. Rodriguez is that she is super patient, kind, and dedicated. My son and I are lucky to have her with us in this time of virtual learning. Thanks to her dedication, my son, who is in first grade, learned to read, write, and add and subtract, among many other things. He is more than ready for second grade. My respect and admiration for her, because working with 26 children on a screen is not easy. I wish all teachers were like her and formed to help form the adults of tomorrow. She is the best. So shout out to Ms. Rodriguez and thank you for your hard work, especially during these difficult times. Up next, we have Miss Alicia Thompson from Cornerstone Health and Technology High. She was nominated by our own Waitrice Harris, who also forms part of this coalition. She has done a phenomenal job during COVID times, spending an exceptional amount of time making videos on her own time for her students to ensure that they are understanding math concepts and minimize learning loss as much as possible. So shout out to Ms. Thompson. Thank you for all of your hard work. Up next, we have Kimberly Seldmayer from Escuela Avanzamos. She was nominated by Norma Quintana. Norma's reasoning for nominating Ms. Seldmayer is, I wanted to nominate this teacher because she has been a blessing in my son's life. She is constant and beautifully gives attention to all of her students and parents. Many thank you from Norma and Michael. So shout out to Ms. Seldmayer from Escuela Avanzamos. Up next, we have Tamiko Perkins. So from Roberto Clemente. So we wanna, she was nominated by Rebecca. She is a great teacher for my son and she has a lot of patience. So shout out to Ms. Perkins. Thank you for all that you do. Up next, we have Heidi Golds from Roberto Clemente. She is nominated by Rosalia Noriega. She is Rosalia's reasoning for nominating Ms. Golds is that she is an excellent teacher. She is very patient and listens to the needs of her students. Her classes are very thematic for every area of work and for what they are doing, and she motivates all of our kids. So shout out to Ms. Golds. Thank you for all that you do, especially during these very difficult times. And so just to recap, we want to thank all of our teachers. Thank you to all of our viewers who have nominated these exceptional teachers. We hope that they can continue thriving through this pandemic, and hopefully soon we will all be able to see each other in person again. So up next, I will present Rajishi. She will continue the rest of the show. Rajishi, I think you're on mute.
And I am on mute. You'd think after a year of doing this, I would figure it out. Thanks so much.
Of Zoom, so no worries.
Wonderful. Well, it's my pleasure to welcome back Hannah Ewing from the Detroit Health Department. So Hannah, welcome. We're always pleased to have you here with us. I know you've got some slides to present, and then I have questions, and I'm sure our audience will as well. Just a reminder, since we're translating, just a reminder to just speak as slowly and clearly as possible so we can make sure we accurately share everything you're saying in the various languages that we are broadcasting in. Thanks.
Absolutely. Thank you for having me. So I'm going to give a quick update about the state of COVID in the city of Detroit, as well as our COVID vaccination efforts and some of the new business guidelines we have to keep our community safe as we continue to work through COVID-19. One second as I get this started. All right, here's the start of the slide deck. So let's talk about what is happening in the city of Detroit. The good news is, as of yesterday, we've had a positivity rate of about 6.4%. And if you heard this talk a couple of weeks ago, we were all the way at 10%. So the city of Detroit is slowly going down. What we're looking for as a relative goal is we want to be under 3%. And that means that it's a lot easier for our wonderful contact tracers to contact those people who have been potentially exposed to COVID-19. And it's less likely that you're going to get it from the community. So anything above 3% we call potential for community spread. If you look at the city of Detroit in comparison to Michigan overall, our numbers are a little bit higher at 6.4% versus Michigan at 6.1%. Our counties next to us, Oakland County is at 4.1%, and Washington County is at 2.4%. So likely we'd like to look a little bit more like the 2.4% in the coming future. Additionally, Outer Wayne County is 4.9%, so they're a little bit lower than the city of Detroit overall. COVID-19 is still all around us in the city as we continue to watch our confirmed cases climb at 50,744. We've also lost over 2,183 Detroiters to COVID-19, so it's still definitely a problem in our community. Let's talk about our vaccination efforts and some of the differences that we see why Detroit may be having a higher positivity rate. So the city of Detroit has vaccinated 36.3% of the population who have received at least one dose. We lag far behind Oakland County at 66.4%, as well as Outer Wayne County at 62.5%, Washington County at 66.1%, and the state of Michigan at 56.2% of all Michiganders receiving at least one COVID-19 vaccine. As a city, we've administered about 80% of our total doses we've received, and we've received 417,000 doses from a variety of Johnson & Johnson, Moderna, and the Pfizer vaccine. We also want to make sure that we're having equity in our vaccine distribution. So we've brought the vaccine into our neighborhoods, our communities, and we're doing pop-up clinics around the city. We've vaccinated 82.9% of all people who are Detroit residents, belong to the Black and African American population, as well as 12.6% white, and then 4.4% are other. So we're trying to do a good job at making sure that we are getting to Detroiters and getting this vaccine into our community. So here's just a couple of reasons to get vaccinated. Reminder that the COVID-19 vaccine will help prevent hospitalization or death. The COVID-19 vaccine is a safe way to help build protection, and the COVID-19 vaccine is an important tool to help stop the pandemic. There's some really great bonuses about getting vaccines, and it's one of the reasons that we are able to get back to normal, hopefully soon. So if you're fully vaccinated, and we'll talk about what that means in just a second, you can dine indoors without a mask, which is something that seems novel. When I went out to a restaurant a couple of days ago, I thought, wow, I haven't done this in a while. You can also attend an exercise class without a mask if you're fully vaccinated. You can attend a crowded outdoor event like a concert or a sporting event if you're fully vaccinated, and you can travel domestically without pre or post travel testing or quarantining, which is really important and wonderful. It's a great peace of mind. And you do not have to quarantine if you were exposed to someone who had COVID unless you start to show symptoms. So if you had an exposure at work or something like that, it's very important that you still continue to monitor yourself for symptoms. And if you do so, follow the quarantining guidelines where you're kind of isolating yourself and continuing to wear that mask if you start to show symptoms. And so what does fully vaccinated mean? It's 2 weeks after your second dose in a 2-dose series like the Pfizer or the Moderna vaccine, or 2 weeks after a single dose vaccine like the Johnson & Johnson vaccine. So that means that you're fully vaccinated. So if you've gone and you've got your 2 vaccines, but it's the day after your second vaccine, you still need to wait about 2 weeks until you're fully protected. That's when we get that good protection, is the 2 weeks after your second dose for the Pfizer and the Moderna, or that 2 weeks after your single dose vaccine like the Johnson & Johnson. So let's talk about some of the mask order for businesses and what you may encounter when going out and about in the city of Detroit. So businesses have the right to require customers and staff to wear a mask regardless of their vaccination status. As a business, they need to develop a preparedness and response plan so that we can make sure that our community continues to be safe with these new guidelines. Businesses are still required to follow the CDC guidelines with their cleaning procedures. This is because COVID is still a threat. We need to have those elevated cleaning procedures to make sure that we are continuing to keep our community safe. Additionally, if you're a business or you have questions about the environmental health of COVID-19, or you would like some assistance developing a plan to help keep your business and our community safe, you can reach out to the City of Detroit Environmental Health Department at 313-876-0135. And if you're an employee or an employer and you're concerned about something, if you have a question COVID related, you can always reach out to my OSHA hotline to ask for support or a question at 855-723-3219. And here's a couple guidelines for the public. So these are guidelines for people who are fully vaccinated, which I just talked about. So when you're thinking about going out into the public, it's important to realize that businesses can ask you to wear a mask even if you're fully vaccinated. I like to think about this as a courtesy. You never know who's behind the cash register or who you're interacting with in a store. They could be someone who has chronic health conditions or a young one at home who can't get vaccinated. So honor them and respect them by wearing your mask. It's also important to be patient during this time and carry your mask with you at all times, even if you're fully vaccinated. And you may need to carry your vaccine card with you, and you can also take a picture of it on your phone or create a PDF of your shot record if you're worried about losing your physical vaccine card. And if you want to get vaccinated and you want to join those who cannot wear a mask in public, you can always give us a call at 313-230-0505 Monday through Friday to make an appointment. We also have many vaccine options and clinics all throughout the community. So you may just be walking down the street and see one, and you're welcome to walk into one of our pop-up sites. There's also some guidance for the Pfizer vaccine for individuals aged 12 to 15 years old. They are now eligible for the vaccine, but it's important to note there's a couple specific steps you must take to make sure that they can get the vaccine with their parental consent. So they must be accompanied by a parent or guardian. Their parent or guardian must show ID, and the parent and guardian must also have a written form of consent for the vaccine. And just a reminder, if they fall between this age category under the age of 18, they are not eligible for reimbursement for anyone bringing a person under the age of 18 to get vaccinated. And this is a little bit more about our Good Neighbor program and some of our vaccine sites across the city. These are our standing sites, but we do have pop-up clinics across the city. And if you go to our website, you can always request a vaccine site for your church, your community group, and we will come to you. And we can also provide an education session so that you feel empowered with education to make the decision to get vaccinated. And if you want to text your address to find the nearest clinic to you, you can always text 313-217-3732 to get vaccinated. And here is some additional information on our community hotline, how to reach us and ask your question related to COVID-19. As well as if you know someone who is bedbound or homebound, you can always schedule them a vaccine appointment using the number 313-446-4444, which is the number for the Detroit Area Agency on Aging, and they will be happy to bring the vaccine to you.
Thank you, Hannah. As always, you give us such nice, clear information and present it in a way that is so easy to understand and follow. We really do appreciate that. So you kind of talked about this a little bit in your presentation, but if you wouldn't mind just sort of summarizing and maybe adding some more information is, we've heard about return to work from a variety of different sources. What does that, in your mind, look like for Detroit?
So for Detroiters, it's likely there's going to be those who've been working from home, a bit of a hybrid model. And the employer does have the right to ask for your proof of vaccination because they want to make sure that if you're not vaccinated, it's totally your choice, but you need to protect yourself and protect others around you. So there's going to be guidance on proving your vaccination status and then also wearing a mask. Even if you are fully vaccinated, also, they still may require you to wear a mask from your employer. So they do have jurisdiction on the control of mask wearing. It's going to be a process where, we at the City of Detroit have the ability to consult with businesses if they have questions too. We can always connect the community with the environmental health to make sure that it's hopefully stressless and organized to get back to work.
So it sounds like for the next few months, especially as we ease into, return to work, we're almost kind of have to sort of be ready to go either way, right? As you said, keep a mask with us and be patient because we can be asked to wear a mask. Important thing you just said is that employers can ask for proof of vaccination status, and there'll be some guidelines around that. I think your message about being aware and thoughtful about why a business might want you to wear a mask and not knowing who was around you is very important. And I think that's something we need to keep in mind, that there are still members of our community who are not vaccinated for various reasons. And so keeping everyone healthy is super important. And I loved your suggestion of taking a picture of your vaccine card so that we don't lose it. Question from the audience here is, are recreation departments opening the city playgrounds, and what are the precautions indoors and outdoors?
I can reach out to my friends at the Parks and Rec department, and I want to get their strict guidance for you guys so it's the most accurate information, but I'll respond by Monday with that information. So
great. And then maybe you can also add, or maybe this, if there's a place where parents can go to get information so that they know what's open and what's safe.
Let me reach out to my contacts and we'll make sure that there's a good line of communications for parents.
Okay. Wonderful. So I think that concludes our questions here, but I just want to again remind everyone with the vaccine opening up for minors, reminders to make an appointment, make sure that every minor is accompanied by a parent or guardian with ID. You have a signed consent form, and as a reminder, there is not a reimbursement for Good Neighbor, the Good Neighbor program when taking a minor. But as we look to the fall and schools returning potentially in person, it's super important that we do everything we can to keep everyone safe. So getting our minors vaccinated is a part of that safe return. So thank you so much. Christine, were there any other questions?
There is. And yes, school. Feel face to face. That's what we're going for in the fall. Patricia just got so excited about it. How long will community vaccine sites remain open, Hannah? Do you know?
For a long time. There's been no plans to close any of them. If anything, we're ramping up more. And as I mentioned too, our community members, if they want to get vaccinated in their congregation or their wherever they feel most comfortable, they can always go to our website and request a vaccine site in their community and in their neighborhood.
Great. Okay. And that is all the questions that I have right now. So thank you so much. We appreciate you coming on. And just so everyone knows, Hannah actually even came on to visit with us from vacation. So thank you for taking time out from your family to be with us today. We're deeply appreciative of you. So Rodrigo, I'm kicking it back to you.
Thank you so much. Hannah, thanks again. We're really, in addition to Hannah, we're going to be hearing from a number of speakers today. We have 4 super important topics, but Hannah started us off with the questions from the Detroit Health Department. We're also going to have Tina Seibel on human resources later on, but it's my honor to now introduce Dr. Larry Ahn from the University of Michigan. Dr. Ahn, you can go ahead and turn on your camera and mic. Dr. Larry Ahn is a co-director for the University of Michigan Center for Health Communications Research and a member of the Michigan Community Engaged Alliance Against COVID-19. He's going to share their work supporting the COVID vaccine outreach within the Michigan Primary Care Association. As he's speaking, we're going to launch a poll. This is actually a first for us on the town hall. This is another way that we want to get your feedback. So the questions on the poll, what we want to know from you is, how many people have you encouraged to get the COVID-19 vaccine? And have you ever talked or messaged with anyone who is either unsure of or opposed to getting the COVID-19 vaccine? So in a few moments here, you will see a poll that is launched, and we invite you to please answer those questions and give us the data. So Dr. Rahn, without any further ado, I'm going to turn it over to you. Welcome. As a reminder, we just ask that you speak slowly and clearly so that our translators are able to accurately share your message in the various languages that we broadcast in.
All right, wonderful. Thank you so much for inviting me to be part of your presentation and meeting here today. I want to start by saying thank you to everybody for everything they're doing to keep themselves safe, their friends, family, and loved ones safe from COVID during these challenging times. That can be people who are doing this professionally as part of their job, but also everybody who's doing it as part of their everyday lives. I wanted to share with you some work we've been doing around vaccine communication training. We know that there's a lot of difference, let's say difference of opinion and different of beliefs about COVID and the COVID vaccine. The question is, what is the best way to have good, productive, non-conflicting conversations as we encourage people to be safe and ideally to get the COVID vaccine? I think Hannah gave us a masterclass just a few minutes ago about how to have those conversations. And I want to share with you some of what we've been doing as part of our outreach in those efforts. I just want to point out that this work is being done as part of the Michigan Community Engaged Alliance Against COVID. Dr. Erica Marsh and Barbara Israel at the University of Michigan are leading that project, but it really relies on the strength of our community partners, which actually include Chaz and Dr. Felix Balbuena, who is helping to direct sort of national efforts. I'm going to ask real quick and see if we have any answers yet on our poll. And if we do, we can take a look at those. And if not, I'll keep on with my presentation and we'll jump back to the poll later. Do we have any poll results?
I am not seeing any just yet, but as soon as I do, I will let you know.
Okay, so maybe we'll come back to this at the end. And like I said, we're all learning new things as we go through the pandemic. So let me, is somebody advancing my slides for me? Great. So we put together this presentation to help the staff at Michigan Primary Care Clinics, so these are community-based clinics throughout the state of Michigan, to have good conversations about the COVID vaccine. We know that there's a lot of information out there, but some of it's sometimes, quite frankly, hard to understand. And so we've tried to make things simple and clear and to help people have good communication strategies so they can have these conversations without getting into arguments. Next slide, please. In the materials we put together, we cover key background information about the vaccine, communication skills and strategies, and we put together some hopefully helpful videos about how to have these conversations. Next slide, please. I'm not going to go over this information in detail. Hannah shared with you some, but in our training materials, we talk about what vaccines are available, how do they work and how effective they are, how many shots do people need, are the vaccines safe, and what are some potential side effects. So really important information for people as they're trying to make decisions about the vaccine. Next slide, please. We also talk about communication skills and strategies. Next slide, please. And really, we talk about the importance of trust. That's one thing we've been learning throughout the pandemic, is how important it is to have trusted sources of information. And I think events like this really help to build that trust. And then we share some information around specific communication strategies. One important thing about communication is that it's a two-way process. It's not just one person telling somebody else what they should do or why, but it's really important that we do something called reflective listening, which is understanding what the other person is saying and hopefully feeling during our conversations. We then want to use that to use a technique called reflections, which is to be able to say back to people, not word for word, but say back to people what we're hearing them say. And that's a way of letting people know we've really been listening to them, which is so important in terms of establishing trust. We want to acknowledge that there are things we don't know about COVID and the new vaccines, and affirm that I still believe we all have more in common with each other than different, such as concern for our own health, the health of those we love, our friends, our family, and our broader community. And that common ground is something that we can find and use in terms of helping us all move forward. And then finally, we use a technique called ask, tell, ask. I'm a physician, so I can say doctors are really good at talking really fast and giving you lots of information, right? And so we're not always so good at pausing and listening to hear what somebody else is saying and what they're thinking and how they understand what we've just tried to share. And so that's what this ask, tell, ask technique is about. Ask people what they already have heard or know, ask permission and then share information, the telling part, and then ask people what they feel or think about the information you just shared. And so that technique can be really helpful, particularly if you're having a conversation with somebody who's maybe feeling a little bit different about things than you are. Next slide, please. And so then what we did is we took these strategies and the information we know about COVID, and we tried to build some scenarios. And let me just go to the next slide. And what these slides show is we show how to use some of these techniques to have an introduction, to start a conversation about the COVID vaccine. And then we built specific scenarios around some of the common concerns about the vaccine, such as it was developed really quickly. How do we know it's safe? Some people believe that the vaccine might actually give them COVID or might change their DNA. So we created examples of how to have conversations around these specific points. And then next slide, and then we'll see, hopefully you'll be able to hear the sound.
Dr. An, not yet.
Yes. Okay.
So we need to ask whoever's doing the slides to reshare with the
audio
sound clipped. Yes.
Yes.
Here we go. She's right on it.
My name is Rachel. I am calling from the Michigan Primary Care Clinic. Your doctor, Dr. Jones, asked me to give you a call. In the past few months, we only had enough COVID vaccines for a few people. We now have more COVID vaccines available, and we reserved one for you. Can we set up an appointment for you?
Yeah, you know, I'm really not interested in getting the COVID vaccine.
Okay. You're not sure the COVID vaccine is right for you. Would you be willing to share some of your concerns?
So just to point out you saw happening there is rather than switching immediately to you really need to get the vaccine or you should get the vaccine, we really want to reflect back the concern we've just heard and then ask whether or not we can continue the conversation. Let's go to the next slide.
My name is Rachel.
Oops. And then this is just an example of how you might have a conversation around a concern. If somebody says they're concerned about how quickly the vaccines were developed or long-term safety. And these are just a way to have that conversation, hopefully in a more respectful and calm way. Let's go ahead and try this video.
I'm thinking about it, but I'm worried. I'm worried that the vaccines were developed too quickly. We don't know what the long-term effects of the vaccine might be, you know?
You are concerned about getting a COVID vaccine because it was developed so quickly. You're really trying to figure out if this is right for you. It's important to know if the vaccine is safe. You're thinking about getting the vaccine, but you need more information before you can decide. Our doctors here have thought about this as well. Is it okay if I share their thoughts with you?
Sure.
You are right that the COVID vaccines were developed quickly. When scientists develop a vaccine, it takes time because there are a lot of steps to make sure the vaccine is safe. When scientists developed the COVID vaccine, they sped up the timeline, but they did not skip any steps. Millions of people have gotten the shot, and the safety is being closely monitored. Our doctors are reviewing any new information that comes out about the vaccine. They think that the vaccines work well and are safe. Getting the vaccine can help protect you and also the people close to you from COVID. I wonder what your thoughts are about this information. Where are you now in terms of getting the vaccine?
All right, and I think the next slide is just my contact information, which
I'm thinking about it, but
sorry, it's just restarting. And I do want to, and we've created resources that's all available through the Michigan Primary Care Association, and we can share with this group as well if they're interested. I just want to call out our sign language interpreter. What an amazing job keeping up with those videos. I'm sorry we didn't plan for the translation when we did that. So wonderful job, thank you. And then the last slide is just my contact information if there's any follow-up or questions. And we're constantly updating this information because we know that the issues around COVID and vaccines are always changing. And I'm done. Did we have any poll results? And maybe not, but I just thought I'd check.
Rajesh, you just went on to mute. We're waiting for the poll results. But Rajesh, do you have any questions?
Yeah, so I think that one of the things you talked about, in terms of strategies to help people get more comfortable, was important. In your experience, having done this now with other groups, what are some of the reasons that people have for their hesitancy with this vaccine?
So I think the thing that we have to recognize is that a lot of people is that COVID is actually new, right? A year ago, a little bit more than a year ago, there was no COVID. There were no COVID vaccines. And we've just been through so much change altogether over the past year that I think people are not sure what is going on and about the safety of the vaccines. And that's where being able to acknowledge that, yes, this is new. Yes, these vaccines were developed quickly, but to help explain why we believe they're safe, I think that's so important. I see we have some results from the poll. And I have to say, credit to everybody out there on the audience. You are sort of super communicators around COVID. Over 80% said they've encouraged 5 or more people to get the vaccine. And so that's really amazing. So thank you for all of that work. And hopefully some of this information can be helpful to you as you're going forward.
Dr. An, another term that we've heard on this town hall a few times, and I don't know that anyone's really truly explained it. So maybe you can, this idea of what does, in the context of vaccines, what does shedding mean? Shedding virus, shedding vaccine. Could you tell us a little bit about that?
Virus shedding the vaccine, in terms of the vaccine causing virus shedding?
Or just what does shedding mean?
Oftentimes shedding can mean it, and this is not really an issue with the COVID vaccines. I believe what it's referring to is that when vaccines were first developed, many of them were what were called live virus vaccines. So it was a modified version of a virus. And so then when people became vaccinated, they would actually have in their bodies this modified version of the virus, and they could, it would come out when they sneezed or maybe when they pooped. I believe that's what people might be talking about or worried about in terms of shedding. That's not an issue at all with the COVID vaccines. None of the COVID vaccines contain any of the COVID virus, nor can they cause people to get COVID. So I believe it's probably a term related to actually vaccines when they were first invented many, many, many decades ago.
Okay, great. That's really helpful. I saw a question in the chat about, these wonderful resources that you have. How have they been received? Have you done focus groups or gotten any feedback from those who've used them, and kind of, talk to us a little bit about their effectiveness?
So obviously this is sort of an ongoing story as it evolves. We did do a training presentation for the staff in the Michigan Primary Care Association. Actually, we worked with their staff to help develop materials. People found them really helpful. They particularly actually liked the videos as a concrete example of how to have conversations like this. We're actually developing new sets of these materials for community organizations that aren't clinics, and actually thinking about a set for people in their everyday lives.
And that would be so helpful, especially, for people on an ongoing basis, because now we've done the vaccines, we're going to have to do the booster shots. I mean, there's going to be this sort of ongoing education piece that we're going to continue to need to have. So resources like that in the hands of, many of us, I think could be really, really helpful.
And I think one thing we learned is how important it is for people like me in a university to partner with all of you in terms of making sure we develop the right materials and have the right message. So we look forward to that continued partnership.
Wonderful. Dr. Ahn, we really appreciate your being here today. The information that you shared was super important. There was a request if we could, we'll share some of the information that was on the last slide. There was a website, so we'll put that in the chat. But we really appreciate your being here. Is there anything else you want to add before I transition to my colleague Janetta?
Just thank you again for all the work that everybody's doing in their personal and professional lives, and feel free to reach out to me for follow-up, and we'll figure out ways to share and partner as we go forward.
Wonderful. Thank you again, Dr. Ahn.
Thank you.
All right, Ms. Jametta, you're on. Enjoy.
Sure enough. And thank you so much, Rajeshri. And Dr. Ahn, thank you. And also the Michigan Primary Care Association, because so often we don't know that there are organizations out there working so hard to make sure that community-based health providers, as well as community-based programs, are getting the information to keep us healthy and safe. My name is Jametta Lilly, and I am so blessed to be the CEO of the Detroit Parent Network, and also a proud member of this really phenomenal coalition that I keep being astounded that we've been doing this work now for almost 15 months. But part of it that we're recognizing now, as we begin to look at what does it mean to go back to work? What is this discussion around back to normal? And certainly I wear the hat of being an employer, but by the same token, wanting to make sure that we are talking about policies and processes that are reflective of science and sensitive to our staff and the community that we serve. And to help us have this conversation, we're really pleased that Tina Seibel is going to join us and bring her HR framework to this discussion. Tina, welcome.
Thank you. Thanks for having me.
Certainly. Tina, can you just share, if you would, just really quickly, a little bit about your organization, and then let's go into a conversation about what does this mean about back to work?
Sure. So I'm currently a consultant consulting a lot of nonprofit organizations, and I'm working with NPAG in Michigan. And right now there's a lot of questions surrounding, returning to work. Returning to work, a lot of employers are doing somewhat of a hybrid model. So I'm seeing a lot of slow transition and respecting of those that don't want to get the vaccine and those that are, believers of getting the vaccine. And I'm probably one of those ones that have not pushed anyone to get the vaccine. But I think that's just mainly because of my HR background and being careful about and sensitive to those that have some concerns around obtaining the vaccine. A lot of employers, especially the smaller ones, might be somewhat out of compliance, but there are guidelines out there that should direct the employers into how to create a safe place or work environment for employees to feel comfortable in coming back to work. There are some OSHA regulations that they have to provide a safe and comfortable environment for those employees to return back to work. The answer of can an employer mandate a vaccine is yes, but like the legal, it kind of depends on a different situations. There's reasonable accommodations, and if you're someone that has a disability or religious belief that is not in line with, obtaining the vaccination, then you need to talk to your employer about that. And with that video that was just shown about, how employers should be asked, or how doctors should be asking questions of why someone may not want to obtain a vaccine, that's kind of the same route that an employer should take with the employee as well. There's going to be situations and that not all employees are comfortable, and employers need to be sensitive surrounding that and be careful about how they're asking questions.
You said something that was interesting. Yeah, so certainly being sensitive. If I could just go back a little bit, because we know that this is both a health issue, but it's also liabilities, it's workforce. You mentioned that there might be some employers that are out of compliance. So could you talk a little bit about, if I am an employee and I'm returning to work, what are the things that the employee should be looking for in terms of safety in that workplace environment?
Sure, great question. And it's typically a lot of small business employers because they're not aware, of everything that they need to have with them at the time. But I would be asking for some type of plan. What's your plan for having people return back to work? You can ask questions surrounding like what things are they putting in place, such as, are there signs up telling employees to continue to get their hands washed, remain, keep social distancing in place, remaining 6 feet from each other, and if not, wearing a mask when you're closer. HVAC questions, so making sure that there's a clean airflow going through the building. And that's stuff that your HR manager should know, or some of the owners should know and be aware of. What are the disinfecting practices within the workplace? What's going on? A lot of these things aren't just written down. And so that's kind of where they could be out of compliance. And so having that stuff written down and, being able to give that to the employee when there is questions can kind of ease some of the nerves when returning back to work.
About that. And where do you recommend that employers of any level, because as you well know, many small businesses, as well for that matter, many nonprofits don't have the opportunity to be able to hire HR. So, you've got executive directors and managers who are doing that important work literally off the side of their desk as well. Where do folks go right now, do you recommend, to be able to develop those return to work policies and some of those best practices that can also be obviously shared with boards of directors and also shared with employees? Where do employers go?
There's so much guidance out there right now, but I think where I would recommend for any employer, small business employers in Michigan to go to is the Michigan, it's called the Michigan Department of Labor and Economic Opportunity.
Okay.
And they'll be able.
Yeah, as you said, there is quite a bit. Do you have any guidance to employers? So let's say people are coming back into our various offices, and not everyone is vaccinated. So you've got a mixed group, people who are vaccinated, some people who are not. What are the requirements, and what are some of the conversations should be happening around the issue of exposure and how to contain that? Any recommendations?
There's not really any type of requirements around, if you're in a healthcare setting and you're working with a lot of, individuals that are maybe have their health compromised, there might be a requirement in that situation. So like a hospital setting. But most employers, even though they legally can require it, they don't have to. I mean, there's steps that they have to go through. So they have to go through like a, you know, undue hardship risk evaluation, and then they also want to consider, you know, the disability and the religious piece components that fall underneath it. Is that kind of what your question was?
Yeah, you know, kind of in that context, from your experience so far, of the organizations, or maybe even just kind of in the state of Michigan, what's your sense of how many employers are looking at a return to work, even though you said it'll be probably some kind of hybrid format? What are you seeing in the literature, and as you talk about your various customers?
I've seen a lot. It varies widely. So some of the customers have, you know, basically given up their office and they're planning to go completely remote, and cut that cost out. And others are doing more of a hybrid model where they're, you know, bringing employees back into the workplace, but just slowly. So it's kind of a split situation. I know some employers are very anxious in getting their staff back into the workplace just to have that camaraderie and just the collaboration. But there's so many tools out there now that employers can use to collaborate with one another, and that they've kind of been forced to throughout this year. And so now it's kind of a common tool that most employers will use.
Okay, and I know we might have some questions, but just two more
Sure.
that came in earlier. One of them is around data. What are the requirements, if any, for employers to provide to the community or to employees about the number of infections that have occurred in that setting, or even for that matter, what percentage of personnel are vaccinated? Are there any requirements around that?
So there is a OSHA requirement that you have to indicate if there's any fatalities surrounding that, you know, an illness was occurred within the workplace. And that comes out every April of every year, and it's posted for about 30 days. Other than that, there's not much other data that I can think of off the top of my head that would be required. I don't believe that I don't think that employers are required to say, hey, percentage of the workplace is been vaccinated.
Okay. Okay. Well, we have one last question, and that is, are there sources or organizations that you know of that are trying to be of support to employers to begin to have these conversations with their staff members? Because, you know, this whole question of should I be masked? Shouldn't I? Do I want to be around people who are not being vaccinated? Employers, those are the kind of conversations that many of us are having. Do you know any resources that or entities that are helping businesses and organizations have those conversations?
Yeah, so I think your first guest too, she had a lot of pop-up clinics, and I think that's someone that could be utilized. And then I also listed out a resource too, but if you just do a simple search online, you'll be able to find a lot of resources in your community that can answer some of the questions you might have. Just this morning, I was pulling up some questions, you know, that might apply to this conversation today, and I was able to find a lot of information and detail to support.
Okay, great. Well, if there's anything we know, that the internet is the windows of the world. So that is our go-to always. So Tina, thank you very much. And we hope that this helped to inform some of those of you in the audience that are small business owners or employers, and know that we are in a very interesting time, because as Hannah from the Detroit Health Department made it clear, there are some return to work rules and norms that are being stated at the federal level. Then there are those that are occurring at the state level. And then we have the reality of the city. And as many of us discussed, there are certain pockets in the city of Detroit that have another level of positivity. So it means that families, that we have to stay informed so we can stay powerful and keep each other safe. And so with that, I want to transition to our other moderator who's part of our team and always who leads us out and going to take us off. And that's Christine Bell. Christine, I'm passing it over to you. Thanks.
Thanks, Jametta. Actually, Tina, do you mind coming back on? We had one more question from the audience. I'm sorry.
Sure.
That was
No
such, like, an
problem. I'm here.
Jametta. Okay. So, and I'm sure you've heard this, or maybe you've in your research you found this, but how do employers handle it when some employees want more precautions than others?
I would go through the interactive. Yeah. I would go through an interactive process with them and kind of question as to, why are they asking this? How, what concerns do they have? You just want to go through those interactive questions with them to find out more detail of like what their concern is, and then address them individually. They're going to be one-off situations most likely. And if it's not a one-off situation, that's something that you can add to your FAQ regarding, a return to work plan of action for your company.
Great. Thank you so much.
Okay.
Jametta did such a nice send off. This is, as an employer and quite frankly, an employee, since, I am an employee of my organization. This is a really interesting time to re-engage and figure out how you do that, and also how you take away the lesson learned from what had just happened. It wasn't all bad, and so we got to learn a little bit about how people can work differently and in a more flexible environment. So thank you, Tina. I'm thinking this might be the last time that we see you. So
okay.
I am going to I normally take us out, but today Rajeshri is taking on that task. So thank you, Tina. Rajeshri, the last words are yours.
So much pressure, such big shoes to fill. Thanks, Christine. So thank you everyone for joining us today. And thank you especially to our presenters and our translators and everyone behind the scenes that makes this happen. We are here to serve the community and appreciate your trusting us and joining us every week. A couple of announcements, and we're going to go ahead and post some of these websites and information in the chat. You'll see it, but I'll also say it. 482 Forward, one of our participating and leading organizations, has launched a community voting tool for each school district in the state to vote on how they would want the school stimulus money to be spent. Please take a moment and fill it out. And you'll find that at michiganjustice.org/community voting, and that will come in the chat in just a moment. DHDC has launched a language justice petition that we encourage and invite everyone to sign. And that can be viewed at actionnetwork.org/petitions/DPSCD language justice. And again, that will come up in the chat in just a moment. Detroit Parent Network has a Young Inventors Science and Literacy Expo on June 9th and June 10th. So please join them. The Congress of Community has board elections. We're calling for nominations for residents, youth, and stakeholders in Southwest Detroit. So please share your nominations with the Congress of Community. You may have heard that the city of Detroit has $400 million to invest into our city, and the mayor is holding meetings over the next 25 days to get input. So we encourage you to attend those meetings. We also are in touch with the mayor's office and have invited him to come to a listening session with us here at our COVID 313 town hall. So stay tuned for that, because we hope he's able to join us and hear the voices of this community. And with that being said, I'd love all of our fellow organizers to turn your cameras on, our speakers as well, so we can give everyone a wonderful send-off. This kind of stuff doesn't happen without hard work from everyone. You see those of us on camera, but there are many more who are not joining us, but we appreciate you all. So with that, I invite everyone to please have a wonderful and safe holiday weekend. Stay powerful, and we will see you next week. Have a great day.
Be blessed all. Take care. Bye-bye.